Now we move on to the coronavirus, the latest there, where there were more than 73,000 new cases reported on Friday alone. That one-day number, the second highest ever, bringing the total cases to more than 4.1 million. More than 146,000 people have now died from COVID-19 here in the U.S.
In an attempt to get more people to cover up, McDonald's and Bed Bath & Beyond are now among the growing list of businesses mandating face masks. And Kansas City Chiefs offensive lineman Laurent Duvernay-Tardif has become the first NFL player to opt out of play in the upcoming season. He's also a medical doctor, writing on Twitter that he knows the NFL has agreed to significant health and safety protocols to protect players, but that he cannot allow himself to potentially transmit the virus simply to play the sport he loves.
Our correspondents are covering all of it this morning. We want to begin with NBC's Steve Patterson. He is in Los Angeles. Steve, good morning.
Hey, Peter, good morning. The U.S. has now recorded more than 1,000 cases 4 days in a row as this virus continues ravaging hospitals and hotspots across the country.
This morning, health officials in hotspots around the country are bracing for the worst, calling states like California, Florida, Texas, and Arizona the next New York.
We have to change our behavior now before this virus completely moves back up through the north.
As the number of cases, hospitalizations, and deaths spike.
Definitely makes the day-to-day difficult as healthcare workers, is not knowing when is the end.
This week, California surpassed New York in total cases and had its own highest single-day death toll back-to-back. In Texas, hospital workers say they're at a breaking point.
It's been a perfect storm. We've had 6 nurses die, 2 doctors die. 4 hours ago, I was putting a chest tube and a nurse I've known for 30 years and putting them on life support.
Dr. Anthony Fauci partially blaming the current resurgence on a lackluster spring shutdown.
We shut down about 50% or so in reality, whereas the Europeans shut down about 90+%.
So please cooperate with us.
As cities across the country are stepping up enforcement on face coverings, issuing citations for refusing to comply.
I ain't paying it. As simple as that, I'm not paying it.
Meanwhile, with just weeks to go before school starts, the CDC released guidelines on reopening, pressuring districts to provide in-person classes. The recommendations include face coverings, distancing, and hand hygiene, saying COVID poses a relatively low risk to kids, still noting 64 children have died since the beginning of the pandemic, and schools should stay closed if there's uncontrolled transmission.
If it's not safe enough for GOP delegates to be hundreds in the convention space, then how is it safe enough in Florida for children to be hundreds in a school?
Friday, the FDA authorized the first COVID test for those showing no symptoms or possible exposure, the agency calling it a step toward the kind of broad screening that may help reopen schools and workplaces.
And back to that school reopening guidance, the CDC is encouraging schools to develop an action plan if a student or a teacher gets sick, but some have been critical of that guidance because it doesn't come with any details or example on what that plan may entail. Guys, back to you.
Steve Patterson for us in Los Angeles this morning. Steve, thank you.
Now we want to bring in Dr. Naheed Bhadelia. She's an infectious disease physician and the medical director of the Special Pathogens Unit at the Boston University School of Medicine. Good morning. Great to see you. We want to dive right in. This virus is far from being contained. At first, it was all about New York as the hotspot, and now we heard Dr. Birx say this week there are 3 New Yorks, a reference to cases rising in California, Florida, and Texas, as you see there in the graph, while New York has largely leveled off. So, Dr. Bhadelia, how do you assess where we are right now?
Well, Kristen, you've heard it said by Dr. Fauci and Dr. Birx in the last couple of days. This is a scary place to be. You're sort of seeing this rolling pandemic through different parts of the country. And even with this next regional pandemic, we're seeing shortages of healthcare workers, of personal protective equipment, of testing. And this is a scary place to be at when we're looking a month down the road to open schools nationally and colleges, which may mean transfer of people from states that are a hotspot to states that are not seeing as much activity. We don't yet have the amount of national production of all this equipment and everything that we need. We don't have a plan for that, for what's going to happen in the fall.
Dr. Bhadelia, the top talker for so many parents, for families, is the idea of trying to get back to school right now. We'll ask you about schools in a second, but I want to ask you about the science first, because I think there's still so much confusion right now as it relates to children, to the students themselves. What does the science say about how easily children can transmit this virus and how it can affect them?
Well, Peter, the science is evolving, but we're not in a data-free zone. We do know certain things. We know that kids under 10 don't get this disease as adults do or older children do, and they're less likely to transmit it. But a new study from South Korea now says that kids between 10 and 19 can actually potentially transmit this as efficiently as adults do. We also have examples, for example, from summer camps in America, in Arkansas, in Missouri, in Texas, where you've seen outbreaks happen with kids of every age, where counselors and teachers have gotten sick. So the science is telling us that this is not a risk-free endeavor, and we need to plan for potential outbreaks that may occur, particularly in schools and highly prevalent community transmission areas.
Yeah, planning seems to be the key word here. What is your message to teachers and to parents to help keep kids safe?
Well, Kristen, I think the one thing that we need to accept as a nation is that this is not going to be an answer that's the same across the board. It's not one size fits all, because every school is facing a different challenge right now. Some of them are facing the idea that if they open and they have an outbreak, their communities may not have that space, hospital space, resources to take on another outbreak. Some of them are facing the idea that they're dealing with older students who might be more efficient in transmitting this disease. And then lastly, it depends on where you are. Are you a rural community or a metropolitan place? If we open too quickly and we are in cities with big class sizes, we may see potential transmission and outbreaks in public schools that are not prepared to handle them.
Well, the focus for families all across the country is going to be on this very issue. So thank you for helping us understand it, Dr. Bhadelia. Really appreciate it. Great to see you.